Hi, my name's Iram Siddiqui, and I am a CBT, IPT, and EMDR therapist working for the private therapy clinic. So, the areas that I specialize in are trauma, anxiety related disorders such as generalized anxiety, obsessive compulsive disorder, and post traumatic stress disorder. So, when I work with obsessive compulsive disorder and generalized anxiety disorder, I would generally use cognitive behavioral therapy to work with those disorders. The way that cognitive behavioral therapy works is you look at the way you think and behave to improve the way you feel. So we would look at the way you think and which would help us to look at the behaviors that you engage in to help change the way you feel. Whilst I use CBT with these two disorders, I am also able to deliver therapy for many other disorders that present, for example, depression, social anxiety, panic disorder, phobias, and I have been doing this for a long time. Another discipline I use for post-traumatic stress disorder is eye movement desensitization reprocessing, otherwise known as EMDR. EMDR is a therapy that is used by therapists when there is a series of traumas or someone finds it very difficult to talk about trauma, which is quite natural. When using EMDR, the therapy requires that we use an image that has come up for the patient, and then we use a series of bilateral stimulation to work through them. Bilateral stimulation can be tapping, eye movement, or other forms which we would talk about and discuss in the treatment. Another discipline that I use is interpersonal psychotherapy, which is also known as IPT. IPT focuses on the relationships that a person has and how they are affected by their depression. Usually, IPT would be used with somebody who had long-standing difficulties with relationships, which was also incorporated with their mood. Whilst every discipline of therapy I offer has a different format and a different process, all three disciplines would require a few sessions at the beginning to assess and formulate your difficulties. Now, this can be quite a difficult process to start off with, but it is an essential way of getting to know your therapist and their style, but also for your therapist to understand your processes, what's gone on for you, and what difficulties you may be presenting with. So if you do feel that it is difficult, just hold on and stay with it, because it can prove to be a very good way of engaging in therapy later on. But in the beginning, it may feel a bit uncomfortable, maybe even a bit frightening. So whilst this process might feel lengthy and slow at the beginning, it is actually forming the bigger part of your therapy, which you will go on to understand a bit better in the main sessions that you do. It also informs the therapist of what the main difficulties are and also what would be forming the main goals for you to work on together. When using any discipline, I also like to incorporate compassion-focused techniques, as this is something that I'm very passionate about. This will mean that a lot of the time that when we work together, I will also ask you to be constantly thinking about how you can be compassionate towards yourself. A lot of difficulties tend to arise in our lives when we become very critical towards ourselves, or we incorporate shame into all the activities that we do. For example, if we make a mistake, we tend to beat ourselves up about it and then feel ashamed as a result. When using compassion-focused therapy, we can actually reduce that shame and embrace the difficulties that we've been having and try to make changes. I'm also able to conduct therapy in Urdu and Hindi. It is something I am very passionate about, as it is important for people to be able to express themselves in their own languages rather than be able to try and look for words in English which they don't feel match what they're trying to say. Something I've been very passionate about during my career as a therapist. Whilst I have some limited availability working face-to-face, I do the majority of my work online. This does not take away from any of the therapy experience that you will have. You can do the therapy anywhere in the world and be able to get through the difficulties that you're facing at this time. This has been my experience since during the pandemic, but even before, where I've worked with people in different countries through the clinic. So if you are looking for therapy and an experience that will help you to focus in on the difficulties that you're experiencing, to be able to problem solve and change the way you are thinking, feeling, behaving, to be able to engage in that difficult time that you've had in the past, to work through trauma, to work through depression. Please do contact the clinic very soon. I look forward to seeing you.